My name is Katie Foster, and this is my Educated Citizen Portfolio presentation for the NMC BSN program. I want to first start off by introducing my public issue, which is teenage vaping in Nebraska. Through my research, I found that vaping is the most common form of nicotine used in the United States among youth, and in 2018 there was a 75% increase in e-cigarette use among teenagers. So why should we be discussing this public issue? First reason is that there are possible long-term health effects that vaping has on teenagers. And second, the overall impact on the healthcare system that vaping has. These teenagers are going to be coming in to clinics and hospitals seeking help, and it's important for healthcare providers to be educated and well equipped with this topic in order to implement proper interventions. I chose this public issue personally not only due to the alarming statistics about teenage vaping and the lack of awareness it has, but also the personal connections I have with my friends and family who have struggled or are currently struggling with vape use. Furthermore, as a future healthcare provider, I do have an obligation to bring awareness to this issue, not only due to the physical health effects, but also the mental health effects it has on teenagers. With the Educated Citizen, I've been able to use the three components, which include the effective communicator, a reflective individual, and a change agent, to create possible interventions and solutions to help this public issue. My first effective communicator experience was in my Nursing 101 course during my very first clinical. We were required to engage in a conversation with our patient using a tool called the Interpersonal Process Recording Tool. This tool had a list of communication techniques, therapeutic communication techniques, as well as barriers to stay away from. And I was able to use this tool and use the therapeutic communication techniques to engage in a conversation with my very first patient. And we actually talked for over 2 hours, and it was really awesome, and I was able to connect with her on so many levels. So the lessons that I learned with this experience was that communication is more than just spoken words. Now this may seem silly to say, but I've never used or at least recognized therapeutic communication skills in the past that I used, and it was really awesome to be able to use some in this experience. The therapeutic techniques that I used were active listening, directing or redirecting, and silent listening. Now, in regards to my public issue, I can use therapeutic communication to talk and have a conversation with these teenagers who are affected. It's really easy to make quick assumptions in regards to teenagers and the negative actions that they take, but this experience has really been able to equip me to be able to throw away assumptions and really engage in a therapeutic way with my patient. And also it will furthermore help me to be able to connect with struggling teenagers also by just actively listening to them, directing the conversation, and silently listening to them to hear their full story. My second effective communicator experience was during my sign language course at the college. I was able to visit the Iowa School for the Deaf. For a project, we were supposed to meet a lady there who actually was deaf herself, and she was in charge of the museum at the school. And we were just there to learn about the history and practice our sign language. And so I was able to do that. Prior to this experience and actually going to the school, I was really nervous to use sign language just because I knew that if I failed in my sign language abilities, that the conversation would be prohibited from moving forward. So this lesson that I learned during this experience was communication barriers. When I was communicating with this individual, I used my sign language the best I could, and when I realized that it wasn't working or there was a problem or a barrier, I would go ahead and find a new solution, like writing something down and asking my question, and we were able to carry the conversation throughout the whole experience. I was also able to recognize my own communication abilities, which I think is important in applying this experience to my public issue, because in order to provide proper effective communication, you should be able to recognize your own abilities so you know when to start something new or use an interpreter or do something different to carry on the conversation. So An application of my public issue, I found in my research that 11.5% of Hispanics engage in vaping as teenagers. So this experience really prepared me to be ready for communication barriers. Like I said, I can go out into different populations in the community and use my communication abilities and recognize my own communication abilities and barriers to reach different populations in Nebraska in order to bring awareness to teenage vaping and help those who, speak a different language than me to help them with their problem. My first reflective individual experience was during my OB rotation at Women's Hospital. Now, prior to this experience, I had a vision of what family looked like. I envisioned that there was a father figure, a mother, and a child. And with this situation, it was the complete opposite. I was actually able to take care of a mother who just gave birth, and she really came from a broken family. She had no support. She was struggling with the image of being a good mom, and she was really, really stressed. And so I had to step back and I had to set aside my own beliefs and really reflect upon myself and what I thought family really looked like in order to be able to educate her before going home and just make her feel confident in her abilities to take care of her newborn. So the lessons that I learned was that each patient has their own story to tell. It was really touching to hear her story, and it was really emotional to hear it as well. And so it really took me back because sometimes you forget to really take in the patient as a whole rather than just assess their superficial assessments and presentations. And so the other lesson that I learned was the ability to set aside my own personal beliefs. And as a reflective individual, you have to do this in order to provide proper care to your patients. So in application to my public issue, I can, when interacting with teenagers who struggle with vaping addiction, I can put aside my own beliefs to create a welcoming environment for them. These teenagers are probably coming from places of stress, and they're scared and they're worried about judgment, and so it's important for myself to create a welcoming environment, knowing that they can share their struggles with me. My second reflective individual experience was in the ICU. I was supposed to take care of a patient, however, they were then going to go home on hospice care, and before they were able to go home on hospice care, they were actually transferred to the COVID unit because their tests for COVID came back positive. Now, this was a really emotional experience for the patient, of course, as well as for me, because this patient was no longer going on hospice care at home, being surrounded by their loved ones and their family. They were now being transferred to the COVID unit, where patients were not allowed to have family members constantly coming in and out. So it was really, really hard to see and really understand the whole situation. The lesson that I learned with this experience was to take responsibility over my own actions. As a reflective individual, you must take responsibility over your own actions in order to be better equipped and change within yourself to be able to provide care to your patients. I've been following the CDC guidelines like many other people, but I really lacked the understanding emotionally that COVID had on some of the people around me, especially this patient. And so in application to my public issue, I can really start asking the tough questions when it comes to engaging with teenagers and their vape use. I can look at my own responsibilities in regards to a healthcare provider, and I can look at my actions that influence others, and I can really start understanding my nursing influence on the youth in regards to teenage vaping. My first change agent experience was a lead testing experience that I had during my pediatric rotation. I was able to perform lead screening at a lower socioeconomic elementary school in Omaha. So of course, the lessons that I learned were assessment skills. I was able to assess these children at the elementary school and their lead levels in their blood. And then any kid that came back with a high concentration, we were able to, assess them and then write a referral to their guardian about educating them about what lead does to the body, how it happens, and then the resources that they can go to get help. And so in application to my public issue, I did find that if an individual made less than $40,000 annually, they had a higher percentage, about 9%, likely to engage in vaping as teenagers. Whereas if they made less than $100,000 annually coming from a family home, they had about 5% likelihood of vaping. And so obviously, in application to my public issue, I can utilize my assessment skills when engaging with these teenagers and just assessing their overall use of vaping. And I can also reach and educate underserved populations, knowing that lower socioeconomic places sometimes lack the education regarding health concerns. I can now use my experience performing these lead screenings and implement them to implement change within these teenagers' lives and hopefully help them get the resources that they need to quit and stay away from vaping altogether. My second change agent experience was on the rehab unit at Methodist Hospital. During my senior clinical, I was able to go to the rehab unit and take care of a couple patients. Now, the rehab unit is really unlike any other unit at the hospital. They really focus on getting better and really figuring out what's going on at home prior to getting discharged. And so the lessons that I learned here was going beyond the superficial assessments. I was able to look at their struggles at home, and I was able to create care plans based on what their desires, their wants, their needs were for at home, and any barriers that they were facing. And I was really able to look at the patient as a whole rather than their superficial health presentations. So in application to my public issue, I can take into account the teenager's whole life story. Like I kind of said previously, in order to be a change agent, you really have to take in all the aspects of an individual or a patient's life in order to implement the proper change. And in this rehab unit, you really had to look at the patient's life back home in order to implement the proper interventions. And then with my public issue, I really can learn the contributions to their addiction, again, by not just looking at the superficial level, but going in deeper and looking at the other influences in their life that has led them to vaping. And hopefully this will be able to implement long-lasting change in their lives. So overall, I am a developed, educated citizen. I have used the three components of the educated citizen ultimately, and they have come together to help future healthcare professionals like myself to better aid their community and provide whole person care to patients. So I can use the three aspects like the educated or like the effective communicator, reflective individual, and change agent to better communicate with my patients as well as teenagers who struggle with vaping addiction. I can use the three components of the educated citizen to reflect upon myself and set aside my own beliefs in order to properly provide care to my patients. I can use the change agent to make long-lasting change and take in all aspects of patient care in order to hopefully make long-lasting change in their lives. And I can use the educated citizen, of course, to advocate for my patients as a future healthcare provider and teenagers who struggle with vaping addiction by educating them, properly communicating with them, and just creating a welcoming, non-judgmental environment to help them. And lastly, I will, of course, continue to learn and practice the three components of the educated citizen. It's extremely important as a future healthcare provider to use these three aspects to be well equipped to provide whole patient care for all my patients in the future.